our patients are very stigmatized by the system, and it's really listening to their struggle to find out how we can collaborate as a team and help the patient get to where they need to go.
Hello, and welcome back to 20-Minute Health Talk, where we will continue our conversation on substance use, addiction, and the journey to recovery. In episode 1, we heard from Andrew Drazen about his vision behind Wellbridge, and Dr. Edmund Hakimi enlightened us on the complexities of addiction and co-occurring disorders. Now let's explore the transformative journey at Wellbridge. Hello, and welcome back to 20-Minute Health Talk. We will continue our conversation with the founder of Wellbridge, Andrew Drazen, and medical director at Wellbridge, Dr. Edmund Hakimi. So, Dr. Hakimi, taking what we discussed about co-occurring disorders, how does Wellbridge seamlessly integrate psychiatric care and medication management with other therapeutic modalities like individual and group therapy, especially for patients with complex needs?
We have a very comprehensive care of team members that help the patients really come out of the treatment well equipped to deal with life. One of the things that we take very seriously is, and this is something we talked about before as well, our patients are very stigmatized by the system. Every touch base they've had with the system, either they were ignored or stigmatized or marginalized. So our approach is always to first make the patient feel welcome. Our goal is to slow down and listen to them because most of the time they know the answer. Mm-hmm. And it's really listening to their struggle and finding out what it is in an interdisciplinary manner between medical, nursing, clinical, to find out how we can collaborate as a team and help the patient get to where they need to go. Our departments don't live in silos like we were talking about before, whereas medical does their thing and clinical does their thing. Is really an interdisciplinary approach for us to be able to manage that patient. Back to the example of someone having anxiety, I might think that medications would help them, but our creative art team might comment that they're doing really well with exercise, so we're able to kind of cut back on the medication and manage them. So it's all about communication, it's all about treating the patient with compassion, and it's about giving them every resource that they need as they walk in, so on the way out they have a highest chance of long-term recovery.
That's great. So we know that recovery just isn't about just the time spent in rehab, right? Mm-hmm. It involves so much more. So what role does family involvement, community, and aftercare planning play in preparing individuals for the real world, for long-term success?
Absolutely. So we know that our patients didn't develop this moderate to severe substance use disorder overnight. So, and we know it's not realistic to have them expect that overnight or within a few weeks that they'll come out the other end, right? Treatment of substance use and living in long-term recovery is a very long spectrum. We are, for lack of a better example, we are the ICU of managing substance use disorder. This is where patients come to us in their very most critical, most vulnerable phase of their life. And our job is to both medically stabilize them, make sure that those withdrawal managements are managed, and give them the tools that they need to structure their life when they go. However, we have a really good, also a continuing care department that everybody gets assigned to, all the patients gets assigned to. And the goal for that is, again, going back to that, the nature of substance use is biopsychosocial, spiritual, right? So all those parts of all those parts of the formula have to be addressed. So biologically we manage them, psychosocially we manage them, but we also connect them with some sort of aftercare, right? So whether it be a long-term, whether it be a partial hospitalization, it might be intensive outpatient or just outpatient, depending on what they need. Also, it's about the environment. So if somebody has difficulty or is unhoused or doesn't have a safe space to go back to because the environment they were in, it plays a big factor in their use, then we help find them recovery housing when they leave. Right?
So you're involved in the social determinants of health as well?
Absolutely. So we have a whole team, we have a whole department that's all they do. They make sure that the patient lands in an appropriate place in aftercare. And then on top of it, we have a whole team that then follows these patients when they leave.
So you're really setting them up for success.
No one leaves Wellbridge without an aftercare plan. And we follow up with the patients to make sure they're attempting to go to their assigned or designated times and meetings. And we also have a very robust alumni program.
Yeah, I was going to ask about that. Do you have patients that come back and share how they're doing?
Well, 3 weeks ago, Saturday, we had 150 alumni come to Wellbridge for an afternoon. We had a tent, we had a barbecue, speakers, very moving. Last year we had 80 show up, so a year later we doubled the attendance. And next year we could have hundreds more. So we are still considered very early in our development, and we're already being compared to other facilities in the country that have been around for 70, 80, 90 years. But what this gentleman has done with his team and the other leaders of Wellbridge is truly remarkable. It's beyond my wildest dreams that we would have such a comprehensive, integrated program to help those who suffer. And that was always the goal.
And I just want to let our listeners know that you opened your doors officially, very challenging time. Tell us about that.
I'd rather not, but but I will. We opened in June of 2020 in the height of COVID. And we had about 70 employees, and we didn't have many patients come to the door. Managed care, the payers, the insurance companies were not very excited to get involved. It was just an awkward time for them. They weren't doing site visits. And it also provided the COVID time an excuse for potential patients not to come. Most patients don't want to come to rehab. It's usually an intervention. It's usually a loved one urging them to go. Very rarely do we find someone who is motivated on their own to come. And in 5 years, I've never seen anybody come to the front door with a smile. I do see a tremendous amount of patients leave with tears in their eyes and gratitude and hopefulness. And that's very rewarding to see. But coming in is another story. So that was a very challenging time, not only for the patients, but also for the facility itself. We are very proud to be in partnership with Northwell Health, and that they have helped us immensely in many areas of our growth. And it's just been a great model together to get where we are today. We have 106 patients in-house today, and I would say 98% of them are covered through insurance, which is remarkable.
So Dr. Hakimi, what's one common misconception about the recovery process that you wish every patient and their family understood before embarking on this journey?
One of the biggest misconceptions that we see is when patients come in and they expect a short detox day to cure them of what's been going on in their life for such a long time. Or they're coming in saying they will need a minor tune-up for what's going on. Or they believe that, they come to treatment and they stay for, let's say, a 30-day rehab, and they feel that they got all they needed. and back to the topic we talked about before, it is about this continuum of care, right? So it's a lifelong recovery. It's a way of life. It's a way of developing a healthy coping, because one of the lines from the 12 steps is dealing with life on life's terms, and a lot of our patients don't know how to do that, and they have used substances for a very long time to deal with those stuff because life happens, right? Jobs are lost, health diminish, we lose people. And we have to be able to develop those healthy coping skills to be able to move on with life without depending on substances, without having to escape from it. And this is something that is not learned in weeks, right? It's a very, very long journey. That's one of the misconceptions. The other thing that is important, and we see this all the time, is even for people that think addiction is a disease, they still feel that relapse is a moral failure. Right? The way we look at relapse is data. Relapse is information for us. So if somebody was in treatment, and whether with us or anybody else, and they return to use, when they come back to us, the information around what happened and what led to the relapse is very important for us. They could have been a adjustment that they need in medication, or something that wasn't disclosed before, or when they left treatment, there was some life event that they weren't ready, they didn't have the tools to deal with. So, and it's like when a kid learns how to walk, when they fall, we don't say, oh, this baby just doesn't know how to walk, right? It's they're gonna fall and they're gonna get up, and they're gonna fall and they're gonna get up until they're able to stand on their own feet. So when patients do return to use, we use it as data, and we encourage them to stand up. We want them that if you fall, it's okay to stand up again. That's where the strength is.
Yeah, relapse is part of the journey. It always doesn't happen. Many times it does not happen the first visit. We have many patients that I visit with and see who have been to 6, 7 rehabs. This is not their first rodeo. And many of them do feel that Wellbridge will be the last one. But the stigma, the shame is still very present. And we are we are succeeding in treating the patient with respect and trying to treat the person as a complete unit, as an individual, and provide them the dignity. And they accept that, and they respect that and appreciate that, and they're very grateful for the care they're getting and the way they're treated. It goes a very long way.
To that point, we actually developed a whole specialty track for people with multiple treatment episodes. So it's a specialty track within Wellbridge. It's kind of like a intensive inpatient, where patients who have had multiple treatment episodes, we'll take them into the specialty track, and the whole purpose of the track is how do we heal them, right? What has not worked for them? What can we do differently this time? We have them exposed more to leaving the facility, being exposed to the community, to find those shortfalls, right, to help them get through.
And we call that track Renew, aptly so. And it's a great program.
And it's from those experiences of relapse and data that you were able to build this track and
Correct.
kind of glean from these experiences what patients might need for success.
Correct. That is very important to us. So, and everybody needs a little different treatment, right? So we do have our general track where, our majority of our patients live. But we have specialty tracks like Renew that we were talking about. We have a specialty track just for healthcare professionals, doctors, nurses, PAs, NPs, pharmacists, so on and so forth. And it's a track that it gears and it specializes especially for those people with healthcare traumas, right? They have a different way of living, they have different traumas, they have different burnouts, they have different accesses. So it's important to specialize it just for them. It's just like when you go, someone gets admitted to the hospital, someone's put on telemetry, someone's put on CCU, someone's put on ICU. It's specialized, and not everybody put it in one corner. So we use that information and background all as data in the specialty tracks. We have a specialty track for first responders, right? For firefighters, police officers, stuff like that, because their trauma is different than the general population. So we really use this data that from patients coming in to help formulate that person-centered treatment model to be able to give them what they need.
Truly an individualized care model. How do you help people to get over the stigma and the shame that's associated with their condition?
That's probably one of the hardest things, right? And it's something that is very personal to me myself. As I mentioned before, I'm a person in long-term recovery myself. In addition to the work I do at Wellbridge, I'm also president of Long Island Recovery Association, which is a grassroots organization helping advocate for people in recovery and seeking recovery. And it really starts by the people who have or are living in long-term recovery, right? Because we have 22 million Americans that are living in long-term recovery. For them to come out of the shadows, right, and put a face into recovery and make it show the population that recovery is possible, because through whether what we see from family or friends or Hollywood or we look at substance use disorder, we look at the tough times of it, the struggles of it. And one of the beautiful things about practicing addiction medicine, being in this field, is to see from the moment that the patient's walking in, like Andy was talking about, none of them are happy, they're all struggling on the way in. And to see them really flourish and thrive into this person on the way out, and this has been a very short span of time. And it's really being encouraging the people that have that long term to speak about it, right? To put a face to it, right? That recovery is possible. This gives both motivation to people that might be struggling out there to come be like, oh, you know what? Like, all I saw was people out there struggling. I didn't know that, my medical director was in recovery, right? Yeah. So it's if the more we stigmatize it, the more it would feel stigmatized.
Also, the healthcare stigmatizes it too. And when I started this, it was remarkable to me to see why the disease of addiction was not treated like other chronic illnesses like heart disease, cancer, or diabetes. And it's not too long ago that addiction medicine, addiction care was not even considered health care. It's not that long ago. It is now, but we've come a long way, but it baffled me why it wasn't treated the same as other chronic illnesses. And that's why we created it, to also the build of the place, the beauty of the facility, and to marry that with the care that's being provided. It's to reduce the stigma and shame. And the patients recognize that. I hear it all the time. No place I've ever been to treats them like this. One last point I want to make is also the staff that we have. At least 30% of our staff are in recovery themselves. And we all go to work, we all have bills to pay. I fully understand that. But our staff do feel that this is a mission for them. And in addition to a job or work, and so many of them would work nowhere else, only at Wellbridge, because this is their fulfillment of what they went through themselves, and they want to share the care with others. And that's why the culture of the whole facility is so remarkable.
And I could feel that, and I could see that.
I'm glad you did.
And Dr. Hakimi, thanks for sharing your personal story and for putting a voice and a face to recovery.
Of course.
Appreciate that.
Yes.
So for someone listening right now, perhaps battling addiction themselves, feeling overwhelmed, or desperately worried about a loved one, what collective message of hope, possibility, and empowerment would you like to share? I'll start with you, Dr. Hakimi, and then I'll ask you, Andrew, to share.
Absolutely. So the message is that recovery is possible. And just because the person might not have gotten it the first time or second time or third time, that doesn't mean that that recovery that they're seeking is unobtainable. If they're feeling anxious about this, that just means there's still life in them. That means that there's still hope in them. And the strength is not to find that perfection. The strength is to be able to reach out and ask for help.
How about you, Andrew?
Well, just go to the Wellbridge website and look up.
That was going to be my next question. How do we learn more about Wellbridge?
Yeah, just go to the website, and if you're seeking care or you feel you're in trouble, our arms and our doors are open for you. And call the admissions number, and we can accept you within hours. In many cases, we will pick you up. If you don't have a ride, we'll transport you. And within hours, it's such a seamless process through our access center to come in. Like I said earlier, the beauty is that in most cases, your insurance will cover the full stay, whatever days they provide for you. So if you're seeking a service, if you truly want to get well, there is no better place to go than Wellbridge.
So thank you for that, Andrew. So if someone is in need of care, somebody needs to reach out to Wellbridge, whether to check in themselves or be picked up, as Andrew mentioned. Dr. Hakimi, what's the phone number that they can call?
Yes, they can call 631-508-5522 to speak to one of our well-trained admissions specialists, and they'll be able to walk them through.
Thank you, Andrew Drazen and Dr. Hakimi, for this incredibly vital, illuminating, and deeply compassionate conversation across these 2 episodes. Your dedication and the work you do at Wellbridge are truly changing lives here on Long Island and beyond. To our listeners, if you or someone you know is struggling, please reach out to Wellbridge. Hope and healing are within reach. Thank you, as always, for joining us on 20 Minute Health Talk. Until next time, be well.